is important to find the right method of contraception as soon as you become sexually active in order to prevent unplanned pregnancies. If you find that you're pregnant and it's not something you want to go ahead with, you're not alone. There is options and there is support out there. There is places that can help you make a decision and then support you with the decision you've made. So there is places out there that can support with unplanned pregnancies. You can self-refer to them. You don't have to tell your GP that you're pregnant. You don't actually have to tell anyone if you don't want them to know. These services are confidential. They will offer you a telephone consultation initially, and then you may have to go in clinic for a scan. Depending on how far along you are, you can opt for a medical termination or a surgical termination. If you're not sure of your decision, there is counselling, so the services also offer that. You can have counselling, and if you decide you want to carry on with your pregnancy or go down to the adoption route, those are options you can certainly go for. The abortion services also offer sexual health screening, they offer contraception. It's, like I said before, they offer counselling. So it's not just about having a termination, it's about supporting women. In UK, there is 3 main providers of termination of pregnancy, and you can access their details online. You don't have to have a GP referral to get in touch. You can just ring them directly and they can give you advice on counselling, unplanned pregnancy, contraception, sexual screening. They cover quite a few areas of expertise. If you did go ahead and decided you wanted to have a termination, you'll initially have a telephone consultation where all your options will be discussed. Then you may have to attend clinic for a scan, and depending on your gestation you'll be able to choose which treatment you may prefer. Termination services are confidential. However, if you are under the age of 18, you will have to have an adult to look after you through the process. It doesn't have to be a parent, it can be an auntie, it could be a friend, it could be anyone that you would trust. As long as they are of the age of 18 and happy and able to look after you, that should be okay. You also have to bear in mind that if there is any complications following the treatment, which in some cases it can happen, and you may need support from the hospitals, that could end up being on your medical records. So although we don't breach confidentiality, in some cases things can be helped.